everybody, welcome to Patholab's third episode. We're gonna talk about nephrotic syndrome. I'm Dr. Negin Khazoui, a semester 4 student at Hearn University of Medical Science. Now, I'm gonna go over the definition of this disease, the pathophysiology, major complication, and its causes. So first, we have to go through the definition. Nephrotic syndrome is characterized by massive and heavy proteinuria, so you have proteins inside your urine. And it also has hyperalbuminemia and edema with hyperlipidemia and lipiduria. So in the urine, you have both proteins and lipids. Now I'm gonna discuss the pathophysiology. So as I said, the first characteristic was massive proteinuria, which is characterized by a daily loss of 3.5 grams or more proteins. And of course, it is less in children in their urine. Normally, glomerular capillary walls act as a size in charge dependence barrier for the plasma filtrate. Now, proteinuria is due to increased permeability of glomerular capillary walls to plasma proteins. So it means in the glomerular filtration, your arteries are more prone to letting proteins go through, which normally they shouldn't. The major proportion of proteins lost in the urine is albumin, and very rarely it is euglobulins. Now, the second thing we spoke about was hyperalbuminemia, which is very convenient now that we have spoke about the fact that it is being secreted in the urine, so it is going to decrease the serum albumin levels and chloride osmotic pressure. Now, exactly when your osmotic pressure decreases, it will lead to an accumulation of fluid in your interstitial tissues, which lead to generalized edema. Now, normally we might have some edemas in some specific parts of the body, but here, because albumin is being decreased in your blood, you're going to have a general edema, so it's going to be soft and pitting. Unless you are going to have hyperlipidemia and lipids. Most patients with nephrotic syndrome have very high blood levels of cholesterol, triglycerides, and VLDL levels, which can be because of stress edema, which is causing cholesterol to be secreted more. A small summary of these four characteristics and how they have been created are shown in this picture next to me. Cause of hyperlipidemia can be due to increased synthesis of lipoproteins in the living or abnormal transport of circulating lipids or decreased catabolism of lipids. Basically, when you have lipids inside the urine, hyperlipidemia is followed by a leakage of lipoproteins across the glomerular capillary walls, meaning that in your glomerular filtration, lipids are getting inside the urine and leakage. Lipoprotein is of course reabsorbed by tubular epithelial cells, but then shed along with the generated cells. Inside the urine, your lipids are appearing either as free fats or as OV fat bodies. Now I'm going to talk about major complications of nephrotic syndrome. The first one is coronary atherosclerosis. Hyperlipidemia predisposes to atherosclerosis of coronary arteries, and you might see also infections in nephrotic patients, cases infection, especially staphylococcus and pneumococci, may be due to loss of immunoglobulins in the urine. You might also see thrombotic and thromboembolic complications. This may be due to lots of endogenous antiquarians like antithrombin 3 and antiplasmins in the urine. Now, cause of nephrotic syndrome are also important. It is crucial to know that the most common systemic cause of nephrotic syndrome are diabetes and amyloidosis, and the most important primoglomerular lesion causing nephrotic syndrome are minimal change disease membrane or glomerulopathy and glomerulosclerosis. You can see the causes of nephrotic syndrome in this table, and in the end you can see in this image Again, the pathophysiology aspects of nephrotic syndrome, such as massive proteinuria, generalized edema, hyperalbuminemia, and hyperlipidemia. Thank you so much, and follow us with the next videos. Bye.